You're listening to the Sacred Mama Podcast. I'm your host, Kara Ray, aka the Sacred Mama. I'm a mindset and relationship coach, helping mothers nurture the relationship between themselves, their spouse, and their children. This is also sometimes inside of a co-parenting relationship. This podcast was designed specifically for mothers, stepmothers, and soon-to-be mothers to come together and truly support one another, to have the real, raw, honest, unfiltered, and soulful conversations about the realities of motherhood. My goal is for mothers to reclaim their self-worth and reclaim their self-identity while navigating motherhood. It's time you treated yourself as a priority because most of all, you matter. I believe that you can have the thriving family life. I believe that you can have the booming business. And I believe that you can have the passionate and abundant relationship. Most of all, I believe you can fully love yourself in the now without sacrifice. Throughout this podcast, you'll gain access to the minds of industry leaders and of course solo episodes by yours truly. So, let's dive in. Hello. Welcome to another episode of the Sacred Mama Podcast. Today I have Megan Orman on the podcast, so welcome. How are you?
I'm so good. Thank you for having me.
I'm so happy. I'm so excited that this is working on here. I'm all giddy about it now. So
I know.
Sorry, go ahead. Go ahead.
Oh, I was just saying I'm so excited too. That's awesome.
So I want to, before we dive in, if everybody's wondering why I'm like reaching over here, I have my son until my husband gets home. So, you know, mompreneur of the year over here, working hard.
You are working hard. You're pulling double duty.
Yes. So before we dive in, guys, I want to give Megan an introduction here. So today I have this pleasure, obviously, of speaking with Megan Orman, and she is a wife and a mama to 2 boys, and she's a postnatal fitness specialist and the creator of Fit and I Stroll Hard core postpartum programs for moms to strengthen their bodies safely after pregnancy and return to fitness. Their fitness regimens that they love. There we go. I got it out. So hi.
Hi.
So before we dive in, I always ask this one question. And the question that I ask is, what is your definition of motherhood?
Whoa. Okay. Starting it hot.
Yes.
Oh my gosh. Motherhood is like crazy, amazing, chaotic. No other experience in your life ever is so overwhelmingly awesome as motherhood. It is all consuming in the most amazing way possible.
I'm love this.
I'm not exactly sure. Motherhood's like everything, all ends of the spectrum. It's the most amazing thing and the most difficult thing. And it can be that way all in one day.
I have to agree. And I honestly think your definition of it, because you were sitting there being like, wow, it's so many facets. Like, how do you just answer this question? This is why I like to start it off this way, because it really gets our minds really thinking about what motherhood actually is to us. Because sometimes we get so wrapped up in what the definition of motherhood is to everybody else that it's important to get back into what it actually means to us.
Yeah. No, I love that.
My son agrees. He goes,
ooh.
Yeah. Okay. So I would love to take a moment and really allow you to dive into your own personal fitness journey and also just your story on how you got into being like into postnatal fitness and really, you know, guiding moms and helping them on their fitness journey. And so I'd really love for you to take the floor and for you to talk about this for a little bit, and then we'll go from there.
Sure. So I found myself being a stay-at-home mom after my first child was born, and I decided not to go back to working full-time. And so for a handful of months, we were kind of struggling, figuring out our routine. He was a very high needs baby, and we really just struggled with any sort of like routine or structure. And although I really loved group fitness and being in exercise communities, I did not see a way to do that with my son. A friend from college who had moved away posted about this group iStroll, and I immediately texted her and said, tell me more about this. It was like moms bringing their kids. It looked like an amazing workout, and from there, it just kind of spiraled into I opened up our own iStroll location here in Bowling Green, Kentucky, which was amazing. My son at the time was over 2 years old, and I had recently found out that I was pregnant with our second, but I was still going to do it. I was still going to open it. So we did it. It was amazing. This community of moms is unlike anything I've ever experienced in my life. So moms bring their kids with them. We get in a boot camp style workout, and the support, motivation, just the camaraderie, and just being able to get out of the house with each other and talk about motherhood and everything that it entails is amazing. Like I said, I was pregnant throughout the opening of iStroll Bowling Green. And as a fitness instructor, I felt like, okay, I'm just going to keep doing this. I'm going to have this fit pregnancy. And I'm just going to jump right back in postpartum. Everything's going to be amazing. I'm going to take like no time off at all. It's all just going to snap back into place, you know? And then, so I had my second child. I was continuing to work out the entire time. I knew that after my first child, I had some abdominal separation or diastasis recti that I worked on healing through Pinterest workouts and all of those great do and don't informations. And then for those of you who can't see, I said healing in quotes. Because so much of that information is highly misguided in Pinterest, but we can dive into that later. So after my second was born, I knew I would probably deal with a little bit of abdominal separation again, but I was also dealing with pelvic organ prolapse, which I was very symptomatic. I could feel it all day, every day. And it kind of overwhelmed my postpartum experience. And so I became obsessed with trying to figure out how to feel better and learning more about my body. Throughout that whole process, I realized that mainstream fitness education knows nothing about women's bodies. We are all trained in how male bodies respond to fitness and wellness. And it was really overwhelming how little information is out there about women, and especially during our pregnancy and postpartum experiences. So I decided to get some formal education, which is specialized and outside the norm that you have to find. And I became obsessed with talking to moms about core and pelvic floor health and why it's so important. And our 6-week checkup is not the end of postpartum healing, not by a long shot. Not by a long shot. And this huge myth that we just push through and keep going and everything's gonna, just snap back into place. And it's just so much more complicated. Our bodies are amazing. And they do something that is so phenomenal, but it also requires that our bodies move and stretch and create this life. And it takes time to strengthen again and work back into the things that we thought would just be kind of immediate in postpartum.
Yes. Okay, so I want to touch on that as well, because I'm trying to get the words out now. This topic is so important to talk about, because as a mom, I gave birth to 2 little ones here, and he's only 6 months old. And when we think about it, like, really, we carry our children for about 10 months. Really, it's between that 9 and 10 month mark is that we're carrying our children. And so for us to think that within 6 weeks, our body is just going to automatically bounce back to what it was before, or even what it was before, like, you're creating and birthing life into this world. You're creating a human. Your body is doing something absolutely beautiful. Thank you. My husband's home now. And I remember having this unrealistic expectation with my first of thinking that if I breastfed that I was going to lose a bunch of weight, that if I, that was like the worst. And then I wasn't able to breastfeed, which pushed me even further into postpartum. But with him, I've been able to breastfeed and things have been very different. But with both of my children, I hemorrhaged really bad. And it was something that's hereditary. However, I did not know this until after, and was told by my doctor and asked if I was going to have any children because he doesn't anymore because he doesn't recommend it. Which is scary. Wow. And so like we can dive deeper into these stories too, which I think need to be talked about because there's so many things that moms don't know that needs to be, you know, acknowledged, talked about, and just brought into light. And so I really want to ask you, you know, what do you believe is the most important factor to be aware of for moms who are wanting to return to their fitness routine?
Such a great question. Such a great question. So I think the most important thing for moms to understand in postpartum is that the pervasive lie in our society is that we do nothing for 6 weeks and then we're, quote, cleared, and then we get to do whatever we want afterwards. Mm-hmm. And it is, if we think about in terms of our body's healing, in terms of any other healing in our lives, say we had a shoulder injury or a knee injury, what do? We have a short period of rest and recovery. Then we start very small, gentle movements, usually through physical therapy, which for everyone out there, there is pelvic physical therapy that every mom should have access to. And it's real for core and pelvic floor rehab, and every mom should have access to that. But there's usually some physical therapy, small gentle movements that they build in intensity. So you don't just, after a knee injury, you don't wait 6 weeks and then go on a run, couple mile run. Yeah, we all know that that would seem crazy, and you'd likely re-injure your knee because it wasn't ready for that intense, high impact activity. It's the same thing in our postpartum bodies. We need to start with smaller, gentler movements, helping our core and pelvic floor recover and rehabilitate and strengthen again, and then continue to increase and add load and intensity. So it's just like that same trajectory of healing any other part of our body in postpartum.
So I have a question for you then. What is something that moms can recognize or notice if they're suffering from, pelvic floor, like those kinds? I'm trying to figure out the word. Can you repeat the word for it? It was
pelvic floor dysfunction.
Thank you. Yep. If they're symptoms with that, what are the symptoms that they can recognize and notice? Because this wasn't something I actually even knew about until a couple months after I had my son. This was something I didn't know about.
And that's so not uncommon. We don't even, at least for me personally, before I was dealing with prolapse myself, I didn't even consider my pelvic floor as part of the muscles in my body and like anything that I needed to be aware of whatsoever. I was just to be honest, I'm like, okay, your vagina is just this hole of like nothing, but there's actually like muscles that are holding up everything at the base of your core. It's so important, plays so many different roles in our body. So I understand exactly where you're coming from. Some symptoms that women can start to notice and pay attention to if they are having some pelvic floor issues, concerns would be leaking. So bladder leaking. It can also be gas leaking or fecal leaking because your pelvic floor muscles wrap around all of those areas under the base of your pelvis. It could be pain, pelvic pain, anywhere in that pelvic region. Your pelvic muscles are directly tied to any of those areas around your pelvis too. So I talk with my hands. So anybody who's not seeing this.
I do too. So I'm here for it.
I know. I'm making like a visual model of the pelvis with my hands, which can also include pain during sex. So many women, one of their common complaints are that it hurts during sex, and they think that's just something that is normal after kids, and that is not normal. So even if it's outside of exercise and during sex, pain there is something that we need to pay attention to as well. Heaviness in your pelvic floor is also a big symptom to be aware of. A lot of women with prolapse describe it as like sitting on an egg or feeling like something's falling out of you. Low back pain, and with core dysfunction, we're looking a lot at doming or coning in the middle of your abdominals. So if you're doing like sitting up out of bed, or you are doing an exercise and you see like the middle of your abdominals kind of pooch up and dome up like this, that's usually a sign that your core really isn't functioning in a way to strengthen that body. There's really just a lot of pressure in that cord that your abdominals are not managing well right now.
Well, and I think the biggest symptom that you were talking about that stood out for me the most was the pain during sex. After I had my daughter, I remember saying to my husband that I was terrified. Like I was just like, I don't even know why this hurts this way, and this is uncomfortable. And I thought it was something I just needed to push through and move through, and that everything would be fine. And I didn't know that it was actually because of other issues that had, been presented through giving birth to a child. Like, I did not know these things. And the fact that this is not information that is taught to moms prior to all of this, really, it almost breaks my heart, because there's so many things that we don't know, or these ridiculous expectations that we place on ourselves due to society and how we think we should or shouldn't be. And, after the birth of my son, I remember feeling so uncomfortable in my body with my daughter, to versus now feeling like, no, I birthed two humans. Like, I sit back and I look at myself and I'm like, holy crap. Like, I actually grew human beings. Like,
yes,
this is cool. And so I appreciate the journey now versus wanting to rush it and change it and feeling like I had to be something different, or that my body wasn't doing enough, but then realizing my body created life. And so now, I have a question for you, because so when you're talking about like lower back pain, can that also be referred down into like your hips? Because I know it's kind of like that area, but can your yes?
Yeah. A lot of people, when they're talking about low back pain, are speaking around that like SI joint. That's where the bottom of your spine is meeting your pelvis. And that's a huge area that we can experience some pain, discomfort. What happens at the end of pregnancy is our tissues and ligaments are so loose and mobile so that our baby can actually be birthed. And so in postpartum, it's trying so desperately to come back together, but you still have those hormones just running through your body for a really long time in postpartum, especially if you continue to breastfeed. And so everything is just a little loose and more mobile, and it is so much easier to feel those pain and pressure points in the back and even in the front where your pelvis meets each other, right at the pubic bone.
Oh, yes.
That's a huge area of pain for a lot of women too.
What do they call that? Because that's almost when there's that hormone that's released, and it's like, is it
relaxin? Yeah.
There we go. It's like relaxin. Yeah. And so then you start feeling almost like this, like you're grinding together. Oh, that was the worst when I was carrying my children. It would literally, I remember with my daughter, I couldn't even stand up straight. That's how bad that one was. I don't have that. It's not that bad now.
In the front of your pelvis there?
Oh yeah.
Pubic symphysis pain.
Yeah, that was horrid. And I said to my husband, I was like, imagine being punched in the junk, like really, really hard, and then having to walk with it. That's what it's like. Yeah. And so I actually, now that we're having more of this conversation, I'm pretty certain that's probably what's also going on with me currently right now. And so I want to talk to you about like the statistics. We were talking briefly just before we came on here. So like, what is the statistics of, mothers who will then suffer with, any of the following, like you were saying, the diastasis recti, bladder leaking, pelvic pain, prolapse, those things. What is the kind of statistics there?
And some of them can be so over the map, because when you're talking, the research that we know right now is that 1 in 3 women are going to experience bladder leaking at some point in their lives, which is a high statistic. And most women don't know that there's anything you can do about that. They think, well, I'm a mom now, this is what happens. And we do not have to live with that. When we're talking about prolapse, those statistics are all over the place. It depends on who you're asking. If you're asking moms if they have prolapse, the statistic comes down significantly because you can actually have pelvic organ prolapse and have no symptoms of it. So a lot of moms during an examination would show that there is some pelvic organ movements during an exam, and that gives us a very high statistic. So, I mean, it's been reported anywhere from like 4% of women have pelvic organ prolapse to over 90% of women. If you're looking, if you're looking from exams, it's a much higher number because we can see the pelvic organs moving. If you're doing self-reported, it's a much lower number. Diastasis recti is really, we don't have very good information because a lot of women don't know about it, or when they do know about it, they don't seek treatment for it. They mainly go to Google or Pinterest and try to deal with it themselves. Yep. I know, the good Google. It's good for so many things and terrible for so many things.
Yes.
Yeah. And so, so diastasis recti is really all over the map. We are not quite sure, but, and there's a discrepancy in how we're reporting it as well, and what we're actually looking at. So much of that research is changing on abdominal separation right now. So, that one we really don't have a good statistic on. But in pain, another thing, just like you were saying, most women deal with the pain and don't really report that. So we don't have a good number for pelvic pain either. So, and so much of this research is just now coming out because women are starting to talk about it more. It's sad that we're now in 2020 and we still don't have good numbers of these issues that women deal with in postpartum. I mean, that really aggravates me so very greatly because we don't even know what women are dealing with. Women suffer silently. We don't talk about it, and we just accept it as normal and something that we have to live with.
Well, and I love that we're having this conversation because I'm very much of having the conversations about stigma topics or just encouraging the conversation. The whole reason why I started my coaching journey was because I suffered with postpartum depression really bad. And there were so many moms that literally, while I was suffering with it, were like, don't say anything about it. This isn't something we talk about. And I was blown away that it was something that women literally believed they had to remain quiet about, just like all of this other information that is surfacing. And I believe like in the last couple of years, women are truly learning to take a stance for themselves and for their body, and to know that, you know, when we create life, that takes a lot of work, and that takes also like your body is constantly shifting and evolving. Like even the hormones in general, like there was this information that I was actually reading on about like the 6-month hormone drop, where your hormones start to drop quite significantly. And there isn't like this actual reason as to why. It just starts to happen about after 6 months after having your little one, and all these things that were happening, or even actually after the birth of a lot of things. The whole reason why I'm talking about this is that a lot of things for moms, I believe, can get misdiagnosed out of silence, but also because you had a baby. So that must be what's it. Because I literally just went through this. I've literally found out for the last like 2 years I've been suffering with gallstones, but my doctor summed it up to the fact that I gave birth, so had problems, and that I also was heavy chested. Yes, let me tell you. And that I was also,
are you serious?
Oh yeah. So they just summed it up to the fact that I was a heavier woman, that I was large chested, and that I had given birth. And then now just recently found out that no, the whole reason why I've had back pain for 2 years is because of this whole problem. So like, it's so important that we advocate for ourselves and that we talk about these things and that we have these conversations, because so many things that could be going on with you and your body can be misdiagnosed because of somebody's lack of care. But also like we have to advocate for our own self-care. Like I truly believe that you need to advocate for yourself.
100%. 100%. I cannot tell you the amount of women that I talk to that are even brave enough to say something to their medical professionals at their checkup, the 6-week checkup. And and they're told, oh, it's not a big deal. Oh, that's what happens when you have a baby or in pregnancy. They're like, oh, honey, everybody gets prolapse after babies. That's just what happens. And I'm just sitting back here screaming because our medical professionals are not well versed in what happens to women and our bodies when we go through pregnancy, and especially in postpartum. And there's so many different reasons why this has become such a large snowball that we're not taking care of moms. But a lot of it is because at that 6-week checkup, our provider gives us a blanket clearance for everything, which is crazy. They're not checking you for everything. They're checking you for very specific things. They're checking to make sure that your cervix is closed, and they're checking to make sure that there aren't any glaring medical red flags for you. But otherwise, they are not checking your muscle function. Most of the time, they're not checking your mental health. That's not their specialty. What they need to do is start referring to people. You need to have more checkups and more check-ins with medical professionals.
With my son, like when we take him to like public health and certain things like that, they have more concerns about a mom's mental health. Like we actually have to go through like a survey before they go and they look at our children, because they actually take care of like our mental health as well. So they look after like our children, and they check their weight, their height, and do all of those things. But then also they go back and look at the questions that you answered, and then they either refer you to someone or ask you to go back to your physician so that you can get the help that you need. And
That's
because
amazing.
At one point after my son, I was like literally borderline. She's like, I think you're borderline for postpartum depression again. This is what's coming up. This is what you're feeling. What do you think about going back to your physician and having this conversation? Because I strongly encourage you to do so, even if you're not feeling like you're there yet. And I was like, well, I don't know if I'm there yet, but yeah, I could go talk to my doctor. And I did. And thank goodness I did. But there are some things in place, but I feel like it's still so disconnected. And like, even with, as you said, like when they give you this clearance, a lot of times moms don't even realize other things that are going on inside their body as well. Like after my son, after I hemorrhaged, because all that stuff happened. I didn't know that part of my placenta was still inside my body. And a lot of women don't actually know this. This is why you can get a fever. This is why you can get sick. This is why you can have pain. You can so many things. This also can be why you don't stop bleeding in an appropriate amount of time. And I remember sitting there with the doctor, and he's like, no, this is what's wrong. This is what's happening. Hemorrhaging in a doctor's office again, like horrible experience. And so it's so important for moms to know these things, because if you don't take care of yourself, if you don't take care of your body, if you don't know what's happening and you're not educated about it, how are we supposed to change this?
Exactly.
So I love that we're having this conversation, because I really believe that it's allowing other women to be knowledgeable about things that can happen. And so I want to ask you, like, what was the biggest struggle that you personally faced when you started or wanted to return back into your fitness routine?
100%. It was dealing with pelvic organ prolapse. Diastasis recti, at that time, I had done a lot more research about, and I felt, even though I didn't know exactly what I was doing, I felt more confident dealing with my core issue. But pelvic organ prolapse was something that I constantly felt 24/7, and it became this mind obsession to try to figure out how to stop this feeling. And I owned my workout program at that time. And so I became very, very scared that this was going to affect my family. We had created this whole community at this point. Did I have to step away from it because I couldn't exercise like I wanted to? It was really, really, really difficult. And if you Google, if anybody is out there and they think that they might be dealing with pelvic organ prolapse, or maybe just a little bit hint of it, or they're overwhelmed with it like I was, I would highly encourage you, do not Google pelvic organ prolapse. Just don't do it. Step away from the Google, because you're only going to find the worst, terrible experiences. The people that are, I mean, there's just, I'm so sorry. Do you hear that? That's my Google going off. Okay, Google.
Google
Stop.
talking about it.
Lord, it started talking about pelvic organ prolapse. I don't even know how that started.
That's
God,
good. That's
you
good.
never know what's going to happen live, right? Woo!
I love that.
That's hilarious. Now I know I'll have to unplug my. Oh, because I said it over and over again. Well, that makes sense. Okay.
Yeah.
Well, don't get on it. Don't even ask yours about it.
No.
But it's always the worst case scenario. It tells you you'll never be able to exercise. You'll never be able to do any of these things anymore. And it's just feels so completely overwhelming. And that is just not the case with pelvic organ prolapse. There are women that do have that kind of experience, but there are so many of us that are managing this condition and doing all of the things that we want to do, even with this. So I would highly, highly encourage somebody to seek out somebody specialized in dealing with pelvic organ prolapse before you go down the rabbit hole or asking your GOOGLE in your house.
And so I actually had a question that popped up before when we were talking about diastasis recti. And so I'm curious, do you know, like, I know you said like the statistics are kind of like a little bit all over the place, but do you know if it is actually more common for women who have a cesarean versus a vaginal birth?
That is a very good question. I do not know whether it is more common for cesarean versus vaginal delivery. I know it's common in both groups.
Okay.
I don't know statistically if it's more in one than the other, but I know it is common in both. And an important note for that as well, since we're talking about cesarean sections, is that C-sections also do not save women from pelvic floor dysfunction as well. So much of pelvic floor complications happen during pregnancy. So just because you don't deliver vaginally does not mean you're exempt from pelvic floor dysfunctions as well.
I think, well, I'm glad that I brought that up because I was just very curious. I was very curious if there was anything that was different between the vaginal or cesarean when it came to that. And
there is, because of the C-section delivery and the healing that needs to happen around the scar that normally, again, another thing women aren't told about, C-section scar massage. Do it. Like Google it, YouTube it, figure it out. Because it's so important, and it loosens up all of that skin and tissue around there so that your abdominals can then function well again. So that is the first thing I tell all of the clients that I work with that have had cesarean sections is start with a scar massage, because if you're having any function issues in your abdominals, loosening that entire scar area up is going to help your abdominals function better after that.
Wow. Well, I'm sure there's going to be women that are listening to this going to be like, why didn't I know this?
Good. I know. They don't tell you about that. Every single woman I've asked that I've worked with, that I've even talked to about after C-section deliveries, I've asked, has anybody told you about scar massage? And they say, no. I've never had a woman say, yes, I knew about that.
My goodness. Okay. So I know that we've talked about so many different things and I don't want to overwhelm our listeners here. And so what I want to do is I want to kind of bring everything together. And I really want to ask you if there's anything that you want to say to the moms who are listening to this right now. And is there anything left on your heart that you really want to share with them?
Oh, so good. So good. Yes. I really just want women and moms to know that we do not have to accept these symptoms. It's not something that just happens because we're a mom. There are so many reasons where our society just belittles experiences from moms. We think that this is just the way it is. Even our medical professionals, like you said, tell us those things. It's just because we've had a baby. It's just, but we do not have to live with them forever. There is help. There's help in pelvic physical therapists or physiotherapists, depending on where you are, what they call them in the world. But there's help there. There's fitness professionals that do have specialized training in working with pregnant and postpartum women. There are people that know about these conditions and are living with them and managing them well. So I would so encourage moms to seek help. If you feel like something is off, it likely is. And there is no harm in asking the questions and digging just a little bit deeper.
Yes. Ask, advocate for yourself.
Yes.
That is incredible. So I want to say thank you for being on the podcast, for having this beautiful conversation. Before we go, though, I'd really love for you to share your social so that they can connect with you further. And so let them know your social links here. And then I will also, once it's uploaded to the podcast, I will make sure that it's in the show notes as well. But let everybody know where they can connect with you.
Awesome. Yes. Thank you so much for having me. This has been awesome. My Instagram and Facebook, you can find me at Megan Orman Fitness, and my last name is spelled Ormon with 2 O's. So Megan Orman Fitness, and my website is meganorman.com. And you can find me in all of those locations, and always you can reach me through email at meganormanfitness@gmail.com if you want to.
Perfect. Okay. So thank you so much again, Megan, for being on the podcast. I appreciate this conversation. I appreciate you taking your time to be here today. And to everybody else, you guys, I will see you all in the next episode. To everybody who's watching this in the community, I will see you guys all through the next live. Okay. Wish you guys an incredible day, and I will see you guys all so soon. Thanks again, Megan.
Thank you.
Thank you for listening to the Sacred Mama podcast. It warms my heart to truly bring forth such beautiful conversations that were created for you to thrive and rise throughout motherhood. Because Mama, this is not a journey we're meant to walk alone. Don't forget to subscribe and share, a review, and you can find more information and connect with me via Facebook and Instagram. You can find me on Facebook at Cara Ray, and also my free community called the Sacred Mama Co. You'll also be able to find me on Instagram as Cara Ray and also the Sacred Mama. It all truly does start with you. And so thank you for tuning in, and I will see you guys all in the next episode.